So, would a US trade deal open up the NHS to US healthcare providers, or could the government stop that if they wanted it to? Niall Dickson joins us. He's Chief Executive of the NHS Confederation, the trade body for health and social care leadership. Morning to you, Niall.
Morning.
Let's start with what US firms are already able to do within our health system.
Well, at the moment, there are American companies that operate here. And again, I think we have to differentiate between life sciences companies, for example, pharmaceuticals and tech companies on the one hand, and those who are actually providing NHS and other services. But the NHS at the moment does put various things out to tender. The irony of this current debate, which I honestly don't think we should be kept awake at night. We've got plenty of other things to worry about around this issue. But at the moment, the government and the NHS is actually moving in the other direction. So the number of contracts that will be put up for tender is likely to be reduced going forward, not increased. And secondly, the people who control all this are actually the state. The NHS itself is run by public officials and so forth. So I think the idea that somehow the NHS is going to be put up for sale is not practical, not likely to happen anywhere near the foreseeable future. And frankly, any political party that sought to do that, and after all, the Conservatives have been in charge of the NHS for most of its years, and they haven't sought to do that.
And yet, some people might say, look, over the years, we have seen not just private sector involvement in providing drugs, in providing equipment and the like, but in the provision of care, that we've had these large organisations like Virgin Health, for example, have been managing groups of GPs or big contracts involving social care. So surely, if the Americans are saying they want health to be part of a trade deal, they've got to have their eye on something.
I think the Americans are, first of all, just don't understand our socialised healthcare system. And I think we look across the water and see a system which is over-medicalised, too expensive and so forth. And so there's certainly a reluctance to embrace that. That doesn't mean that we should turn our backs on anything that comes from America. Indeed, there will be American companies that have expertise that can go into alliance with the NHS and actually do positive things.
But the fear people have, or some people have, is that if, for example, an American healthcare provider runs a region's healthcare, or indeed its GP services, it's a much smaller step than to say, well, why don't they run all NHS services, or a great big chunk, to, in other words, privatisation?
They're not going to be able to run a region's health services. I think that's absolutely clear, and the government's made that clear, and NHS England's made that clear. It will be a publicly run and publicly controlled going forward. And I simply don't see in the next 10 years, we've got enough challenges ahead going forward, that we're going to embrace any kind of future of that kind.
Oh, I wouldn't dare put words in the lips of a former esteemed BBC editor. But are you saying it's a fuss about nothing?
I think it is a fuss about nothing.
Oh, I did, and you quoted them back. Niall Dickson, thank you very much indeed.
The time is